Delivering preventive services is really challenging because for a number of reasons. I mean, number one, billing, it doesn't necessarily get captured in that very well when it comes to the time spent with counseling our patients. Obviously, there are preventive health codes, which we certainly utilize those all the time, but the amount of time spent does not really get captured as easily. So honestly, we do what we can. When we're trying to address something with our patients, they have a specific issue. Um, More often than not, we have to do it over the course of many visits. Um, Alternatively, we'll have the patient get involved, maybe perhaps with a dietitian or a health coach if we have that availability, but it's not always possible.
Mhm.
And patients also aren't always willing to participate in that. They want it actually to be face to face, through their provider because we know the best and they know us, so they want that connection.
Yeah.
Um, so I think that the biggest take home is that it's just a difficult thing that we all need to accomplish, do a better job at. Well, maybe we'll take an example of, say, a patient who's diabetic or newly diagnosed, because obviously that's pretty common. And when we try to get into it with trying to approach the dietary choices that need to come to fore with them, uh, as well as working on increasing physical activity, trying to manage weight, as well. Most of the time involves trying to uh, encourage weight loss, but at the very least, trying to get them more active and incorporating some of these new changes into their lifestyle. But then that is also, layered on top of, hey, we're going to start you on a new medication, and we need to talk to you about side effects of that. And we need to bring you back in periodically and have different medication checks and different blood tests as a part of that. It just becomes overwhelming for a patient to do that all at once. So as a result, we try to do it a little bit at a time. Um, so I'll get somebody started on something and try to uh, insert some of these new lifestyle changes into that
Slowly.
discussion slowly, right?
Yeah.
And then if it is a new diagnosis, then I'll bring them back, a month later to insert a little bit more of that,
Yeah.
and slowly build. Uh, but that, is an opportunity that unfortunately then takes time away from maybe providing care, for another patient.
Yeah.
And bottom line is we don't want to overwhelm our patients, especially with a new diagnosis. And
Yeah.
so if there's some other approach that we can incorporate into our practice to try to help, bring that along, that they can do on their own, or not on their own per se, but alongside of us, as well as with some other coaches, that's going to be really valuable. Um, well, as family medicine physicians, one of the things that we're very skilled at is trying to better understand where the patient is coming from. Because more often than not, we also take care of other family members of theirs. Uh, we also very much understand, their lifestyle. We understand uh, some of the various different socioeconomic, hurdles that may also uh, uh, be part of the obstacles that we're going to face when we're trying to help them. So when it comes down to it, um, trying to help the patient understand this is a lifestyle change that they're going to need to make, but we're also on a journey with them so that we can help support them. And whatever tools that we, have, at our fingertips to be able to help support them is what we're going to need to. Some days that's going to be easy for them to understand. Our patients come from all sorts of various different backgrounds, education levels. And so um, being able to provide something to them that is going to, cover that spectrum is going to be really important, but oftentimes lacking. And also the amount of time that it may take with one patient to accomplish that task uh, could be completely different for another patient to accomplish the same task.
Yeah.
So having something that is more asynchronous that could be done not just in the midst of a patient visit, in the doctor's office, but they can also utilize, in their day-to-day lives would be, I think, really key because these are lifestyle changes that we're talking about.